Whether you're new to health insurance or want to brush up on what you know, you've come to the right place. The more you know about health insurance, the easier it is to make decisions about your health and save money on your care. Let's get started. Health insurance helps you pay for the medical care you receive. Having coverage helps you get care to stay healthy. It also helps you save money on care when you're sick or injured. Your health plan helps pay for your doctor's visits, hospital visits, prescription drugs, and more. Everyone will need to use the healthcare system at some point, whether for routine care or emergency services. Health insurance protects you from paying the full price of that care. Once you've enrolled in a health plan, you and your health insurance company will work together to pay for things like doctor or emergency room visits, prescription medications, yearly vaccinations, and checkups. This is called cost sharing. There are other terms you'll need to know when choosing a health plan. Let's review some of the most important ones. The first is a premium. A premium is the amount that you must pay each month to your health insurance company for your health plan. You have to pay your premium each month to keep your health coverage active so it can help with your medical bills and other healthcare expenses. You may qualify for help paying your monthly bill. This kind of financial help is called a subsidy or a premium tax credit. The subsidy helps make your plan more affordable. Most people choose to use their subsidy to pay their monthly bill, which lowers the amount you have to pay each month. Some people qualify for enough financial help to pay for their entire monthly premium, and they have no monthly payments. Once you have a health plan, there are a few different terms that explain how and when you need to pay. Your deductible is the amount of money you pay for some doctor's visits, prescriptions, and other health services before your health plan starts covering part of your bills. After you've paid your deductible, the amount you pay for your healthcare services typically gets smaller. There are some healthcare services your insurance company pays for even if you have not met your deductible, such as yearly checkups, vaccinations, many cancer screenings, and blood work. These preventative services are available each year at no extra cost to you. Your insurance company may offer certain services at no out-of-pocket cost. Out-of-pocket costs are the portion of a doctor's visit or prescription that you pay. They're also called copays and coinsurance. Here's how copays and coinsurance work. Let's say you've met your deductible. The next time you visit the doctor, instead of paying full price for the visit, you'll pay a copay instead. This is a flat fee you pay for your care after you've met your deductible. If your health plan has a $25 copay for visits to a primary care doctor, that's the flat fee you'll pay for each primary care visit. You may also have to pay coinsurance. Instead of a flat fee, like a copay, coinsurance is a percentage of your total bill. For example, if your health plan requires 20% coinsurance for visits to a primary care doctor, that's the percentage you'll pay. Your health plan will pay the remaining 80%. So, if your bill is $100, you'd pay 20% of that, or $20. And your health plan would pay the remaining 80%, or $80 for services your plan covers. Why is this important? Because your plan will also have what's called an out-of-pocket maximum. This is the most you'll pay each year for covered medical services. For example, your plan might have an out-of-pocket maximum of $4,000. That means once you've paid your out-of-pocket maximum, in this case, $4,000, for healthcare services, your health insurance company begins paying 100% of your covered medical services for the rest of the year. You have no additional costs. Your health plan also decides what typical costs should be for your care. This is called an allowed amount. Your health plan will only pay this amount for your care. That brings us to the next two terms you'll want to remember: in-network and out-of-network. In-network doctors have an agreement with your health insurance company to provide care. These doctors have also agreed to the amounts your insurance will pay for your care and services. Out-of-network doctors do not have an agreement with your insurance company. Depending on your plan, this doesn't mean you can't see a doctor who's considered out-of-network, but it does mean you'll likely pay more for those services if you do. When you see a doctor in your plan's network, your doctor won't charge more than your health plan will pay, the allowed amount. But if you see an out-of-network doctor, they may charge more, and you may have to pay the difference. Now that you're familiar with some common health insurance terms, Let's talk about the types of health insurance plans that are available. There are two main types of health plans: HMO plans and PPO plans. HMO plans often have lower monthly costs and a primary care doctor who helps you manage your care. With an HMO plan, your primary care doctor coordinates your care and helps guide you through the healthcare system. They'll refer you to other doctors or specialists when you need their care. With most HMO plans, you're only covered when you visit doctors in your plan's network. Services and visits considered out of network are generally not covered with this type of plan, unless it's an emergency. With PPO plans, you have more flexibility. This means you can visit in-network and out-of-network doctors, and you don't need a referral from your primary care doctor. But this often means PPO plans have a higher monthly cost and higher out-of-pocket costs for certain services. Now let's review how these plans are categorized. Health insurance plans are broken down into 4 metal levels: bronze, silver, gold, and platinum. You'll find HMO plans and PPO plans in each of these levels, so you can choose a plan that works best for your needs and budget. Here's what makes these health plans different. Metal levels determine how you and your plan will split the costs for your health care. Generally, the higher metal levels, like gold or platinum, will also have higher premiums or monthly costs. But the amount you'll pay when you go to the doctor, fill a prescription, or go to the hospital will be less. You'll also generally have lower deductibles, copays, and coinsurance when you choose a higher metal level plan. With lower metal levels, like bronze and silver, you'll often have lower monthly costs, but you may have to pay more when you go to the doctor or fill out that prescription. That means your out-of-pocket costs will likely be higher. However, depending on your income, you may qualify for a special program that's only available on silver plans to lower your out-of-pocket costs. This means you'll save money on copays when you need to see your doctor. But remember, it's only available on silver plans, and your eligibility is determined by your income. Metal levels make it easier to compare health insurance plans, so you're getting the care you need at a price that works for you. Rest assured, the metal level you choose does not affect the quality of care you'll receive. It mainly affects how much your health insurance will cover when you need care. When selecting a health plan, cost is not the only factor to consider. Here are a few questions to keep in mind. Can I still go to the same doctor and hospital? What medications are covered? What pharmacies are in network? What special services are offered to help manage my health? What extra things are available with my plan? Selecting a health plan can feel overwhelming, but answering questions like these can help you make the best decision for you or your family. For extra help, including additional resources to help you get covered, visit getcoveredflorida.com. If you have questions about the Affordable Care Act and how it affects you, you're not alone. So what exactly is the Affordable Care Act? The Affordable Care Act is a health care reform law that was passed in 2010. You may know it as ACA, the ACA, or Obamacare. The Affordable Care Act makes health coverage more affordable and easier to get. Through the ACA, you may be able to get financial help to pay your monthly premiums, and you can shop for a plan and enroll online through the federal government's health insurance marketplace. You can shop for a plan through the health marketplace as long as you live in the U.S., are a U.S. citizen, or have a qualifying immigration status, and don't have Medicare coverage. So what does the ACA cover? Every ACA plan includes coverage for essential health benefits. These benefits include hospital care, pediatric services, mental and behavioral health, preventive care or wellness, and emergency care, laboratory services, prescription drugs, doctor's office visits, and rehabilitation care, and more. ACA plans also include many preventive health services at no additional cost. That means your doctor's office shouldn't charge you when you get these preventive services. There are 2 types of financial help available when you enroll in ACA health plan. The first type is called a subsidy. A subsidy helps lower how much you pay for your monthly bill for your plan. How much you get depends on your household income, how many dependents you have, and where you live. The other type of financial help is called a cost share reduction. Cost share reductions help lower the amount you'll pay when you go to the doctor, fill a prescription, or seek other health care. To qualify for a cost share reduction, you'll need to enroll in a silver plan and meet a household income requirement. According to the Kaiser Family Foundation, most people who qualify for an ACA plan are also eligible for financial assistance to help pay their monthly bill. You can also choose to receive the tax credit at the end of the year instead of using it to pay your monthly bill if you want. Here's how it works. If you choose to use your financial assistance towards your monthly payments, the government sends your financial assistance, sometimes called a subsidy, to your health insurance company. Your health insurance company will use the money to pay your monthly bill. Then they will only send you a bill for whatever you still owe. For example, if your insurance costs $950 a month and your subsidy is $925, you will only have to pay $25 for your monthly bill. In some cases, your financial assistance may cover the entire cost of your health plan, so you won't have to pay anything extra to your health insurance company each month. There are 2 times when you can buy an ACA plan. Each November, you have an opportunity to enroll in a health plan for the upcoming year. This is called open enrollment, and you don't have to meet any special conditions to sign up during this time. During open enrollment, you can sign up for the first time or switch to a different plan if you don't like the one you're already enrolled in. Open enrollment for ACA Marketplace plans starts November 1st and typically ends December 15th, but the government may extend the deadline. You can also enroll in a health plan within 60 days of a major life change, no matter what time of year it is. This includes things like having a baby, getting married or divorced, moving to another country, or losing your health insurance from work. ACA plans are now even more affordable because of the American Rescue Plan Act of 2021. Under this new law, more people than ever qualify for help paying for health coverage. Millions of people can get a better plan with better benefits for less money. Even if you haven't qualified for financial help in the past, you may be able to get it now. Since the American Rescue Plan was passed, 4 out of 5 people who enroll in an ACA plan pay $10 or less each month for their plan. For extra help, including additional resources to help you get covered, visit getcoveredflorida.com. When it comes to health insurance, there are a lot of myths that just aren't true. Let's clear up a few of these myths. Here's the first myth. I can't afford health insurance. Many people actually think health coverage costs more than it does. You might look at a plan's price and think that's how much you'll have to pay each month. However, 9 out of 10 people in Florida actually qualify for financial help to lower their monthly payments. And even more people are eligible now because of the American Rescue Plan. Some are able to get a plan with no monthly payment. In fact, more than 700,000 people in Florida are currently missing out on getting a health plan for themselves or their families with a $0 monthly payment. Another common myth is thinking, I don't need insurance. Here's the problem with this myth. No one plans to get sick or hurt, but at some point, each of us will need health care. Did you know the average cost of a ride in an ambulance is $1,500? Or that the cost of fixing a broken leg is about $7,500? The average cost of a 3-day hospital stay is around $30,000, and comprehensive cancer care can cost hundreds of thousands of dollars. Medical bills can cause stress and financial strain, and you may lose income if you can't work. With a health insurance plan, you have a partner to help you through these tough times. Here's the next myth. I'm healthy and plan to stay that way. The truth is, having health insurance actually helps keep you healthy. With health insurance, you get access to many preventive services at no extra cost. Wellness checkups, vaccines, and screenings, like mammograms and colonoscopies, are covered with $0 copay. Also, having a health plan makes it more affordable to check in with your doctor more often. Seeing your doctor regularly helps catch health problems earlier, when they are typically easier to treat. Another myth that keeps people from getting health coverage is finding a plan is too confusing. Actually, help is easy to get. A health insurance agent can help you find the right plan and make the process easy. They'll explain health insurance in a simple way and find a plan that covers what you and your family need. It's their job to check if your doctor is in the network, tell you exactly what your plan covers, and look up the cost for any prescription drugs you take. Your agent is there to help you. They can show you ways to save money on your coverage and plan for out-of-pocket costs, like copays. And reputable licensed agents can help you at no cost. When you're looking for an agent, make sure to ask if they're appointed by a health insurance company to sell their plans. Not all agents are experts in all plans. Appointed agents will be the most knowledgeable about the plans they are selling. Another option for help is finding a health navigator. A health navigator can show you all your plan options and help you enroll in the marketplace at healthcare.gov. Another myth that keeps people from finding coverage is believing agents don't really care about what I need. But here's the truth. Agents are experts in health insurance who are licensed by the state. This means they're bound by law to be honest and trustworthy. An agent can help you compare plans to find the best fit for your needs. They can help you understand what you bought, and most importantly, your agent can help you squeeze the most value out of your health insurance plan. Finding an agent you trust is a great first step towards shopping for and using your plan. For extra help, including additional resources to help you get covered, visit getcoveredflorida.com. If you're new to the United States, you may or may not know that universal health care benefits are not offered here. That's why it's important to enroll in a health care plan. Without health insurance, getting health care can be expensive. Health insurance offered through the Affordable Care Act, or ACA, isn't just for U.S. citizens. In fact, many immigrants may qualify for an ACA marketplace plan and get financial assistance to help pay for it. Some of the immigration statuses that qualify for marketplace health plans include lawful permanent residents or green card holders, asylees, refugees, individuals with worker visas, student visas, and some other visas, persons with temporary protected status or TPS, and lawful temporary residents. To see a full list of immigrant statuses that qualify for ACA health plans, visit healthcare.gov/immigrants. Don't worry, signing up for an ACA health plan won't affect your immigration status, and checking your immigration status on the federal health insurance marketplace will not be used for immigration enforcement purposes. Also, you only have to share your immigration status if you're applying for a health insurance plan. Federal and state health insurance marketplaces cannot require you to share the immigration status of your family members who are not applying for coverage. They also cannot keep you from getting insurance coverage if you don't give them this information. Last, applying for health insurance will not affect your chances of becoming a lawful permanent resident or U.S. citizen. It's normal to have questions and concerns about healthcare in the United States. That's why finding a licensed health insurance agent in your community that speaks your language is important. Your agent can help you enroll for health coverage, apply for financial help, and answer your questions. For extra help, including additional resources to help you get covered, visit getcoveredflorida.com. Now that you've learned the basics about health insurance and how to get a plan, here are resources you can use to help you get the coverage you need. Signing up for an Affordable Care Act, or ACA, health plan is easy. There are lots of options to help you get started. Let's review them. You can work with a licensed insurance agent. Search for a licensed health insurance agent in your area to get expert help. Make sure they're fully licensed to sell health insurance and authorized to sell the plan you may be interested in. And finding an agent that speaks your language will help make sure you find a plan that fits your needs. Another option is a health navigator. Health navigators are not tied to any one type of health plan, and they can help you understand which health plan options in the marketplace are available to you. To work with a health navigator, call 877-813-9115. You can call the Federal Healthcare Marketplace directly for help 24 hours a day, 7 days a week. They can help you enroll in a plan and see if you qualify for financial help. You can call the marketplace at 800-318-2596. You can also enroll online without the help of an agent or health navigator. Just visit healthcare.gov to apply, view your eligibility, shop for plans, and enroll. You can also get tips at healthcare.gov to make signing up for a plan easier. And finally, You can visit getcoveredflorida.com for extra help with your health insurance needs.